What got me started in physical therapy was I was, as a teenager, was an athlete, and through my athletics had a few injuries myself, but I always had a strong interest about the human body and about science. So initially when I went to college I was pre-med, and during my schooling became more exposed to physical therapy and kind of thought that this would be a way to combine my love of science and sports together, and to be able to spend good quality time with my patients. So at that point I went on to do some volunteer work in a hospital and really found that this was my niche and this was really what I wanted to do. From that point I pursued my education at Downstate Medical, which is a state university of New York, and got a bachelor's degree in physical therapy. I graduated there in 1982, and then from there went on into the hospital and worked there for a few years. But the one thing that I think is unique about this profession is that you could be in the profession doing many different things. So from the hospital, I went to home care, and then while doing home care, decided to further my education, and I went to Queens College, where I got a master's degree in exercise physiology. So that kind of, I look at it as upgrading my skills and knowledge about the body and about exercise with people that have disease processes. Later in time, I went on to further my education once again and got a doctoral degree in 1999 from the University of St. Augustine. And my primary focus there was ergonomics, looking at the study of work and how work affects people and how people sometimes get injured through their job. Probably from the time that I got into the field, I always thought that someday I would have an office of my own. And I combined that with a colleague of mine, Mary DeVita. We worked together at the hospital. And in 1987, we decided it was time to, try it on our own. So we set out, had an office in the Tottenville area of Staten Island, where we were two primary therapists there. And we worked full-time jobs at the hospital and then worked in the evening at the office. And over the years, the office got busier and busier, and then we, devoted more of our time to that. Now, the office has been in existence for 19 years, and we've seen many Staten Islanders from many different injuries and a lot of their family members as time has gone by. But also now we have a staff of 7 physical therapists, 1 physical therapy assistant, and probably at this point I'd have to say hundreds of volunteers and aides that have come through our system and training who then go on to become physical therapists. As a physical therapist for 23 years now, I have to say that every day is just exciting as the day before. Every day is a new challenge. There's always, the one thing that I like is really the patient care, being able to work with people and taking them from point A to point B. Sometimes people ask me the question, like, don't you get depressed? Doesn't it bother you when you see people with injuries? And the answer is, you know what, I have the knowledge about the injury and about how the body's going to heal, and when I'm able to teach a patient about that and able to take somebody step by step of how to get better, I have to say that there's no greater thrill than seeing somebody walk in, with crutches or not able to walk, and then 2 or 3 months down the line to be able to go back to, skiing or golfing or doing whatever it was they wanted to do, and being happy about it. So when people come in, they are in pain and they may, not be so happy, but the one thing that happens in therapy is you get transformed. And if you go to any physical therapy place, you're always going to find happy therapists around you, people with good senses of humor, and people who love people. And that's really part of our job, is just helping somebody, not only physically get better, but even emotionally and socially through their interactions with the other patients that they see, because it almost becomes a camaraderie. Up here in the gym, when the patients are working out, people are coming 2 or 3 times a week. They get to know each other, and everyone's starting to root for each other. So it's really a team effort, and there's definitely nothing else in the world that I'd rather be doing than being a therapist. So I don't think of it as work, even though this is my job. I love work every day, and it's my life, it's my passion.
Hi, my name's Virginia. I'm the insurance verifier. I basically get all the authorizations for a patient. Lana takes down the information, the insurance information. I call the insurance company to verify their insurance. If they need authorization, I have to usually fax over a request. And when I get the answer, I call the patient and we schedule the appointment. If they need additional authorization, I get the prescription from the doctor, or the patient usually brings the prescription in, and I fax that over to the insurance company, basically to get the patient authorization to be treated, because without that, they can't be treated. Well, if I fax over, a lot of times the patient doesn't come in with the prescription, and I try to get the authorization without the prescription, which is usually very hard to do, so I have to call the doctor's office to get the prescription and fax it over to the insurance company. A lot of times the patient calls and asks, why didn't I get the authorization yet? And I try to tell the patient, I call every single day. It's not my fault if we don't get it right away. Basically, yes, the insurance companies do give the authorization. When we get denials, if the patient does need more, we will put in an appeal to see if we can get more visits. I would say most of the time we do. And if not, we give the patient an option to go on a payment schedule with us, so that they can get treated. We try to make it as easy for the patient as possible. Well, if the patient gives all the information when they call for their initial evaluation, and we have everything, it's very easy to just call the insurance company and verify the insurance. Once we have the insurance verified, the patient can come in if we have all the paperwork in order.
My name is Christine Battaglia, and I'm from Staten Island, in Eltingville, and I've been diagnosed with a condition called plantar fasciitis, which basically is a really bad pain in my heel. My condition started about 2 years ago, and how exactly it was contracted, we're not sure, but we think it has to do with a heel spur I had on my other foot, which then led me to favor the right foot, and then this condition occurred. Well, what happens is it makes everyday activities such as walking very difficult. So those nice walks around Wolf's Pond Park in the morning became painful.
And did it change your life any other way?
Well, yes, actually, when you get out of bed in the morning, the first step down is painful, the trip down the stairs is painful, every step becomes painful. Before I came to DeVita Becker, I was seeing a podiatrist who had suggested inner soles, who had given me a treatment of anti-inflammatories. We even tried a cortisone shot, and nothing really gave the relief that I needed. Well, when I came to DeVita Becker, we set up a regimen of electronic stim and massage, and what happened was I started to feel results shortly after. The initial treatment wasn't as helpful at first, but they told me to have a little patience, and I did, and then I started to feel better. Well, I've been given a night splint also, which I wear at night, which keeps my foot flexed in the right position. And now in the morning, that first step out of bed is no longer painful.
When I think of some of the most interesting cases, I mean, definitely there's several. One case that really comes to mind was a woman that came here initially. She was actually a healthcare worker and had been injured when a patient fell, and she fell along with the patient and injured her back originally. When she came here, she was walking with a walker, but she was a young person. She was in her 20s. She was in excruciating pain, was not able to work, could not do any of the usual daily activity things. She needed people to help her dress. As time went on and she came here, she was able to move freely, and she progressed on to being able to walk with eventually crutches. And then what happened was that she was stopped from therapy because she had plateaued at that point in time. As time went on in the future, she had to have several other surgeries just because of her injury. But each time, after each surgery, she came back for therapy. And with each time that she came back, she got better and better. And this has been somebody who, it's not the typical case. Most of the patients here are usually here for 6 to 8 weeks. Their body heals and they go back to their normal lives. She's somebody who, through years, has been here but has undergone many surgeries. But the one thing I have to say is that each time that she comes back, you know, she is just ready to dive right back into the therapy because she knows how important it is and how it made